This is my presentation about the yellow fever. Yeah. Well, by the way, I hope you get better for after a doctor appointment. So let's talk about the pathogen of the yellow fever first. The yellow fever virus is an arthropod-borne virus belonging to the family Flaviviridae. The genus is Flavivirus. The yellow fever genome is an 11 kb single-stranded positive sense RNA genome coding for polyprotein, and the size is usually between 40 to 65 nanometers. It's pretty tiny. And the life cycles of flavivirus. Well, a lot of them has very similar things to do with the protein react with the cells. Well, first we got the virus attachment and enters the cell, and we got the virus fusing and disassembling in the endosome, and then we got the protein translation, and then the viral RNA replication on membranes, and all the way till the end, the mature virus was released outside the cells and ready to enter another cell. And as I know, the human flavivirus is a dead end host to the yellow fever. And yellow fever was usually carried by the Aedes aegypti, aka as the yellow fever mosquito. And the yellow fever mosquito has a maximum size of 16 millimeters, and the weight is usually 2.5 milligrams, or 0.0008 ounces. Is tiny. Yeah. And the lifespan usually varies from 2 weeks to 6 months. We usually get the yellow fever through the bite of the yellow fever mosquitoes, and the mosquitoes usually carry their virus inside their stomach, and when they're biting our skin, their saliva, which carries the yellow fever virus, just enters the human blood. And the mortality rate of yellow fever usually varies from 30% to 70%, depending on the sanitization of the different places. And the common symptoms are fever, chills, general body aches, vomiting with blood, and one of the most distinguishable ones is yellowing skin and eyes, as you can see in the picture. The person who infected with yellow fever, well, has yellow eyes. And that's pretty much how the yellow fever got its name. And let's talk about the occurrence of yellow fever. Well, most of them lies in the tropical Africa and South America, and those places have a lot of heat and moisture, which is very easy for mosquito to born and live with. And yellow fever usually lies there. There isn't a lot of yellow fever occurrence in America, so far as I know. The scientists know very little about the mechanism of immunity to yellow fever inside our human body yet. Well, what we know so far is the antibody response evoked in man by the infection. And long time after the virus is gone, our body is still generating neutralizing antibody inside of our body. Well, the neutralizing antibody can be demonstrated in body as long as 75 years after an attack of disease. So just rest there for a pretty long time. And the treatment for yellow fever, we haven't found any specific treatment to benefit patients with yellow fever, so if you got it, you are basically screwed. But the care should be taken to avoid certain medications such as aspirin or non-steroidal anti-inflammatory drugs such as the naproxen, which may increase the risk of bleeding. Well, trust me, you don't want bleeding when you're getting yellow fever because most of the blood you lost is by vomiting. The yellow fever patient should be protected from future excuse me, from future mosquito exposure. Well, it makes sense. How do we protect ourselves from yellow fever? Well, we should use an insect repellent, wear proper clothing to reduce mosquito bites, and we should be aware of mosquito hours such as summers. And next time when we see a mosquito, we should just kill it with no mercy before it bites you. And fun fact about yellow fever. It was originally named black vomit because people have blood in their vomit, as I said before. But it does not make any sense to me because, well, our blood is red. And the United States has made an attempt to eliminate all the yellow fever mosquito, but has not been successful yet. It's a very hard task. Yellow fever mosquito is particularly found of human ankles when it's searching for a good spot to bite a human. I found it very interesting because I consider the human ankle as the worst places to bite because we got our arms with like plenty of muscles, or our chest, our necks, even faces, but ankle is just like one layer of skin and just bones. I don't even know what they choose it. But anyway, the first breakout in America is in Boston, 1647, which is nearly 400 years ago. But so far, there isn't a lot of yellow fever virus in America right now, so we don't have to really worry about that. And here's a citation. Most of the stuff I just searched on Google, and there's some of the Wikipedia website. It's been very useful for me. So, thank you.